Behavioral health at Henry Ford Jackson Hospital and Drug Free Jackson. Population health is Rebecca Calkins. Hi, Rebecca.
Hello.
Nice to see you.
Going good.
Yeah, Rebecca's been in every health area.
Yes.
Behavioral, population, and now you guys, you're working on a special event.
Yes, so we're having a summit, the Advancing Behavioral Health Summit, next Thursday,
Okay.
the 23rd, from 8 to 3 p.m. We have a lot of different trainings involved. We are also offering CEUs, medical CMEs, social work CEUs, and McBAP prevention CEUs as well. So this is an educational opportunity, but it is still open to the public as well. I think parents can get a lot about it, or people that have family that are working through addiction as well.
There are people that are providers, professionals,
Yes.
clinicians. They have to get
Yes.
certain training updated every so often, right?
Yes, yeah, absolutely. So we'll have those for social workers. Medical this year is new, so I'd love to get more nurses there next week. And then anyone with the substance use designation on the end of their title. So that's what McBAP is for.
What are some of the topics that will be
Yeah.
covered?
So our keynote is Dr. Lazara from Henry Ford Health.
Oh, he's
and
great. He's been here
there
on
we
many,
go.
yeah.
Yeah, so he's going to be talking about the medications for opioid use disorder, those things that help with the cravings. Withdrawing from an opioid is never pleasant, and the more you can ease yourself off of that, the more likely you are to continue in recovery. And it's a great tool, and sometimes it has some stigma. It feels like you're, replacing one substance with another, but it's completely different. It's really about regulating the dopamine in your brain so that you don't have cravings, and you're able to then work through whether it's therapy or group or things like that.
Oh yeah, I'd be interested in hearing more about that, because what I've seen is that it's very controversial, and there are
Some
some
people, yeah.
some places they say, "Well, we're not going to use that," but you can't. It's hard to understand why.
Right. Yes, it's not replacing one substance with the other.
Yeah.
It's not extending an addiction with another. I'll be talking about this actually, and when I'm presenting as well, talking about the levels of dopamine in your brain. So without any substances, the best your brain can do is about 100, and heroin's about a 900. Meth is about 1100. And so when you talk about someone voluntarily going back down, they're not going back down to 100 either, probably going 20, 30. They're, real low. Going from that as their new normal, it's not easy, right? And
Right.
you need a lot of support and support groups and therapy and things like that. But medication to kind of stabilize those dopamine levels while you're learning those skills.
With the summit, we're talking about both mental health and substance abuse. Is there a connection or not?
Absolutely.
There is. Okay.
There is we see statistics around, we look at the youth in the MyFi data and the surveys they take. We see depression rates increasing, right along with marijuana use increasing, right? And so it's a lot about self-medication. And when they feel like, when I interview the kids, and we've had some focus groups and some conversations around that, it's a lot of stress being a kid these days, right? And so some people feel that that's a way to cope with the stress, and we want to teach them better, healthier coping skills so they don't turn to substances or something more dangerous.
Yeah, anyone can get marijuana now,
Yes.
but it does have it can provide people with more issues.
Right.
By using
Yes.
it, yeah.
Yes. So there are some medical conditions that have, and they're still studying it. That's the thing, is now that it's starting to be legalized, they're really doing some studying. However, our brains are not fully developed until 25, and I really equate the marijuana conversation with the alcohol conversation. You got to wait till you're 21 and don't drive on it. I think that's key. And I get parents that come up to me and say, "How do I talk to my kids about it? I use, but I don't want them to use." And it's, how do you talk to your kids about alcohol? It's the same conversation, really. It's not healthy for minors to be using it.
Trauma-informed care. What does that mean?
Yes, so talking about our ACEs, or adverse childhood experiences, talking about how our past can influence both mental health and physical health, mental health and substance use, and physical health as well. Thinking about I often hear people say, well, that's not important. You should just pull yourself up by your bootstraps. It's all in your head. There's where I was going with that. Your brain is in your head, and your head is part of your body. Like, this is physical health and mental health. They're equal to me in that you need to be taking care of both, and that, traumatic experiences can affect both of those things.
Suicide prevention has been a big push,
Yes.
both of you personally, but also in your role, and that's part of what the summit will talk about too.
Yes, we will be talking about some suicide prevention topics as well as postvention. So how do you support the family after a suicide attempt? And some crisis intervention, things of that nature. So yes, it's wide topics around mental health as well. And that some people feel we don't want to talk about suicide. If we don't talk about it, it'll never happen. Well, clearly it's happening, and there's statistics to show that it's increasing as well. And so the more that we can talk about it and normalize getting help, the more likely someone will survive and go on to lead a normal life.
So a regular citizen can
Yes.
come to this right off
Yes.
the street.
Yes. Yeah, absolutely. Not everything's, some of Dr. Lazara's stuff might go over your head, but the mental health stuff, I'm also having a speaker talking about marijuana use in youth and things like that. So if you have a child that's been starting to get into that, you can bring back some knowledge that way as well, and how to have those conversations with your kids.
Vaping and tobacco?
Yes, as well, yes. So both of those kind of go hand in hand, because you can put THC in a vape as well. So
Oh, really?
right. So sometimes you don't know what's in that vape. Or they're bringing gummies to school and passing them off as regular candy. That's a thing as well. So just being able to have a conversation, an honest conversation. Back in the DARE days, it was all about scaring kids, right? And that's not effective, we now know. And that really having honest conversations with the kids and helping them to understand consequences.
So sign up, and it's $25 and includes breakfast and lunch.
Breakfast and lunch and all the CEUs.
drugfreejackson.com/summit. Nice. Thanks, Rebecca.
Thank you.
Rebecca Calkins from Population Health at Henry Ford Jackson Hospital and Drug Free Jackson. Our